Okay, so specifically I'll be talking about fractionated CO2 laser resurfacing. In my experience with this in Pittsburgh. So, I've purchased a number of different machines, laser rejuvenation machines. And like so many things in life, there's a bit of a spectrum. Some of them I'm really very happy with. And this is the single best sort of the machine that's the base of this talk that several other people in this room own is the best machine I've ever purchased. I have others that I'm happy with, but I have a few that I'm less happy with. So here we go. No disclosures, presentation contents. We're going to talk a little bit about conventional, meaning non-fractionated CO2 resurfacing and why that has largely gone away. Some of the indications for this procedure. What is fractionation exactly? How does it work? Some of the basics of patient selection, anesthesia, post-laser care, complications, and then a couple of examples that myself and some of my colleagues have produced. Okay, so this is the machine. I received not 1 cent nor any benefits, nothing of any kind from this company. This is ELLMAN, which was recently acquired by a larger company, but it has 2 things on it. There's the fractional CO2 scanner right here. There's this little pistol-looking thing strapped onto the side of this. This is an erbium YAG laser, which we use in concert with the fractional CO2 laser, I'd say 85% of the time, and we like the fact that we can combine those procedures together. But I'm not going to emphasize that hardly at all because that was not what I was asked to speak about. Conventional resurfacing limitations. So back in the mid-90s, late 90s, this became quite popular. We were able to achieve sometimes quite stunning results with fully ablative, non-fractionated CO2 lasers. However, everybody in this room, I think, is aware of this history. The recovery was pretty arduous. Many patients, a full 2 weeks of looking like heck, okay, looking red like Jill Hessler's shirt over there, okay. But then, even if it were just that, but then months of sort of, erythema, slowly diminishing erythema, and that was too much. I think the market simply moved away from it. And then 2003, 2004, a whole host of very non-ablative, not just IPL, but things like Fractional, non-ablative, the 1540 handpiece on the Palomar unit came out. I think patients certainly appreciated the much lower downtime. They could come in on Friday, get their treatment, and they went back to work as whatever profession they were in on Monday, and they were pretty much good to go. Now, they had to come in sometimes a month apart, 5 or 6 times. I think it would have been fine. They liked the lesser imposition on their life, and they certainly lacked the lesser degree of complications. However, the problem was that sometimes, 8 months after that last treatment, and we had this experience, just you're not looking at much, and patients absolutely don't like it after spending cumulative over those 5 or 6 treatments, a significant amount of downtime and money. And so, off late in the last 5 years or so, fractional ablative treatments, specifically fractional CO2, has very much come into its own. And it's my personal opinion that this strikes a pretty healthy balance. I think patients and us, our communities, have been educated that you can't just kiss the skin with some sort of thing that's going to make you a little bit red for 48 hours or so, even if you kiss the skin 5 times, separated by a month each time, and expect this enormous change, or any meaningful change. What you're actually doing here, of course, is you're causing a controlled, benign, controlled sort of injury, and you need to have some sort of recovery from that injury. So I think they fairly artfully struck this balance, where you can have much less downtime, a much lower incidence of complications, though not zero incidence of complications, and get real results. Okay, common uses for fractionated CO2 laser systems. Again, I'll be fairly concise. We all sort of know what they are. It's sun damage, it's aging skin, it's moderate wrinkling. This is the kind of patient, the average patient where I practice in Pittsburgh, Pennsylvania, might be in their late 40s, 50s, 60s. We do not have an extraordinarily ethnically diverse population. Most people in my part of the country are Caucasian. I have lots of Fitzpatrick 1, 2, and 3, so we have many candidates for this laser in our practice. Some of the technical details, CO2, spot size, and pulse duration. So the spot size of 150 microns in this case, it's just what it sounds like. It's the spot. It's the size of that tiny beam of light coming down on the skin. The pulse duration is how long the light is on. All of these parameters, of course, can be manipulated in order to get a less or more intense treatment. Fractional technology. The energy is delivered from the epidermis through the papillary dermis and poking into the reticular dermis, 100 to 750 microns. Each pulse of CO2 energy ablates not just the column of tissue, but then heat spreads out from those columns. And the idea is over a period of 3 months, 4 months, you get continued collagen contracture in response to that heat injury in the tissue that was not ablated. And so this is the idea. On the left, we have the erbium YAG handpiece that's attached to this machine. That's the depth. It's an ablative laser too. And that's the depth it goes to. But obviously, the fractional CO2 lasers penetrate much deeper. And this is the idea of what causes this degree of contracture. I do want to say one thing. We're very, some patients come in, we've talked a lot about surgical versus non-surgical. They're saying, well, geez, I'll do the CO2 laser and I'll get some lifting. As soon as a patient uses that vocabulary, I'm clear about the kind of lifting that you can get from this. You can get some modest tightening over time, but we consider and we articulate to the patient that this is mostly a surface treatment. We're mostly trying to improve the quality of your skin. We're not really trying to lift anything with this because, as you know, patients will take basic vocabulary and run with it in their own way. Geez, I can avoid a lift. Maybe I'll just do this. We tell them, no. Okay. The chemophore, the target is water. So I'm going to go very briefly through this. This is the control panel on this device, but it explains certain concepts around this. So you can see the scan size. That's the size of the little quarter shape. You can adjust the shapes that is actually burned each time you pull the trigger. The duration is how long the light comes down. The density is within that size. Let's call it the size of a quarter. What percentage of that skin is actually ablated? You can go from very high. This would be 80%. I'd consider that high, 80, 85%. Or you can go down to lower, 15%. We usually go intermediate, 35%. So the duration, pulse duration, amount of time the light is actually delivered into the skin, usually in milliseconds. So the depth of the lateral heat, if the light goes down for a longer period of time, it doesn't necessarily penetrate deeper, but it's heating that core for longer, and the heat moves in lateral direction around those columns more so. And you would like to think that you can get more contracture over time if you do a more aggressive treatment, in other words, a longer duration. Density is what I referred to earlier. If you want a little bit of feathering, if you've been very aggressive on the cheeks and you want to feather into the neck, as you can see there, 13 to 17%, 20 to 35% is for mild to moderate wrinkles. That's 35% is probably the most common treatment in my practice. And we tend to lean a little conservative. We've never had a complication of significance with this laser, not even one. 50 to 70%, I know plenty of people who use that safely. I know people who routinely use 80%. I think if you did that consistently, eventually you're going to see a little bit of hypopigmentation here and there if you don't pre-treat patients and such. Okay, patient selection. Logically, everybody in this room understands you're looking at Fitzpatrick's skin type, you're looking at the severity of aging. Adnexial density, has this patient had radiation therapy or something like that? Obviously, you need to ask about that. Patient expectations. We find our patients are, unlike some of the other devices we use in our practice, which we basically don't use anymore, but we find overwhelmingly patients are happy. Having said that, we put a fair amount of time into managing patients' expectations. We tell them we're not going to get this skin as smooth as a baby's bottom at all. We're trying to get a meaningful, measurable, obvious, like their neighbor 2 doors down will look at them, and if they ask them about their skin, the neighbor will immediately sort of see it. We think we can deliver those results fairly consistently. Patient selection, 1 through 3, always great candidates. 4, be a little careful. Some pre-treatment, we'll talk about that in a minute. Fitzpatrick 5 and 6, not in my practice. Everybody knows the Fitzpatrick scale. Patient considerations, look for important points in the medical history, psychological, physical, list of medications. Are they using Accutane? Some people would say you have to be off for 6 months. Some people say 12 months. Recent sun exposure, not just before the procedure, but after. We like people to have been very low intensity on the sun. It's not that we won't do this at all during the summer, but we slow down a lot during the summer. We do a lot more of this sort of from October, through maybe April. If it's in the summer, you better be fairly fair and you haven't been, swinging a golf club in Florida or something like that. We want to know about history of herpes simplex and infections, their skincare regime. If they have a tattoo, remember CO2 lasers were one of the original lasers used to remove tattoos. So if they have a tattoo, you're not going to treat anywhere near it because you're going to damage the tattoo. Patients who should not be treated, pregnant, poor health, etc. I'm going to skip through this. It's fairly obvious. Unrealistic expectations. I talked about expectations. They need to know that, we are happy to. I remember talking to Devinder Mangat about 2 years ago, and he was telling me about how, as you know, he's reduced chemical peels down to a science. He's very, very good at it. But like anybody who's done a lot, he'll tell you very plainly, compared to 20 years ago, he's much more conservative. Because eventually you'll get into trouble. We want to stay well within the zone of safety with the use of lasers. And so we tell people, we're going to get a good, sort of 60, 70% improvement, and we're happy to leave the rest on the table. If you want a little bit more, come back in 2 years, let's do it again. Anesthesia considerations. Most of our patients, we have a wonderful sort of topical cream. We put it on. Many of our patients just do that. Some patients are understandably a little bit nervous, so we use some Xanax or something like that. We typically don't do facial blocks. You certainly could, but we typically don't do facial blocks, and we typically don't do oral pain medication. What to expect post-treatment? This is the beauty. This is sort of the punchline of this sort of device. And this is, I think, what's been articulated here is pretty conservative. Some people, they walk out of our office and they actually look pretty good. We tell them, though, they need to be patient because in about a day and a half they'll look considerably worse. After a day and a half, they look like they've got the worst sunburn they've ever had. But we tell them, after 2.5 days, it's like a mild sunburn. After 3.5 days, after 2.5 days, it's a moderate sunburn. 3.5 days, mild sunburn. 5 days later, most of these patients, and there's some peeling and some flaking and some itching in between, but most of these patients 5 days later could go into their local grocery store and get off with it. They might not want to go to a big social event, but most of our patients, certainly by 7 days later, they are up and at 'em. They can go back to their law firm and work. They can do what they need to do. If there's an intense social event going on, I think 10 or 11 days out, they have to go to a wedding or something like that, 10 or 11 days out, I would feel very comfortable that the vast majority can do that. And that's a whole different world to what we were dealing with in the late 90s. Post-treatment care, it's all about using sort of the moisture blocks. I won't go into too much detail on this, but we're very in touch with our patients. We have them communicate pictures to us every single day for the first 8 days, every single patient. We make sure they're taking care of their care appropriately with these various sort of lotions and potions. Complications, laser skin resurfacing complications include, as I say, we have not had a single case of hypopigmentation. We haven't had, we've had some protracted erythema. We've had people with some redness up to 2 weeks. We've had some people with edema up to about 2 weeks. But we've certainly not had any pre-auricular or post-auricular necrosis or any significant hypopigmentation. We have had occasional hyperpigmentation, which can be irritating, but it goes away consistently. I think in those cases we probably could have been a little bit more aggressive or selective with our pre-laser treatment, but it goes away.
You treat the post-auricular area?
No. Good point, Dr. Wong. No, we typically don't treat the post-auricular area. Let's see. This is just sort of the expected things that one would experience. Patients feel intense heat for about 70 minutes afterwards. We apply cooling, usually not ice cold, but cooling compresses and such. There's itching. Itching is a fairly common and consistent complaint. Some of these ointments invariably start to cause irritation of their own, and so you're sort of juggling these different ointments. But all of these things, again, if you stay in regular communication with the patient, in regular contact with the patient, you don't even really have to manage it. You just need to inform them of what's going on and let them know that this is nothing to be concerned about. Like I said at the top of this presentation, we very frequently combine the deeper penetrating fractional CO2 with the much more superficial erbium YAG. When you apply the erbium YAG on top of the fractional CO2, immediately afterwards, it's like polishing the skin. We find that our use of IPL has diminished in our practice because dyschromias and what have you, we can get substantial improvement such that it's difficult to cost justify doing IPL after this. What we do find is some patients don't want any downtime and they hate the dyschromias. Well, then, of course, IPL. Okay. similar points. Some results, fractional CO2 results here. You can see the settings there. Here's a lady. I think the picture is sort of reasonably impressive. It's not overwhelmingly impressive what I'm showing here, but I can tell you, in person, the results are substantial. We hear this comment quite a bit. People who are in their late 40s, early 50s who have been progressively, many people are wearing less and less makeup nowadays in Western Pennsylvania. They're not really doing the makeup. But then they slowly start to do so more so into their 40s, into their early 50s. I've heard half a dozen times, wow, geez, I don't wear hardly any makeup anymore after this treatment. And that's always music to our ears, because people are doing that because they're seeing the irregularities, whether it's the fine wrinkles, the moderate wrinkles, or all of the sun damage. And if you're not wearing makeup, it's because you're no longer worried about that. This is my buddy Sam Lamb. He just sent in this picture. I think this may be somebody in his office. So again, I look at that at first blush compared to some of the surgical things we do. It's not, it's not like I would fall out of my chair if I saw one or the other walking towards me. But what I can tell you is I've seen consistent results. If we do 20 patients, 19 of them, they come into our office and they shoot us the thumbs up immediately. This was great. And we've not always had that experience with our energy devices. And in my mind, that's good. And there's other elements to this particular device, no disposables. We like that. It's very durable and reliable. Thank you very much for your time.